Hey everybody, I just want to congratulate each one of you all for passing nursing school, graduating. That is a huge accomplishment. Now it's time for the next step in starting your nursing career, which is taking boards. So I just wanted to talk about just two things right now that I think is really important, which you probably implemented during nursing school because that's how you were successful. But you want to carry that on. So when you go take your boards, I don't want to say easy, but you'll keep these things in mind. First off, there was one change of many that started back in April of this year for the boards. You have 5 hours to take that test. 5 hours. I didn't have 5 hours when I took mine back in 2017, which was my LPN, and 2022, which was for RN. We didn't have that much time, but now you all do. So with that in mind, you can take your little breaks if you need, bathroom break or breather, whatever you need. But let me tell you, while you're doing that, keep in mind to read each question carefully. Read it slow so that way your mind can process each word. Because the thing about it, in these questions, you want to find out where your keywords are. What are your key phrases? Because then if you can point those out, then it goes to the next step. Now you identify the key phrases. You also notice different keywords. What are some of those keywords you're saying? Immediately. So you may have a question that has immediate attention for a patient. That means there's something acute going on with that individual that needs your immediate attention. If you go in a room and you notice that the patient is in distress and they're having respiratory issues, what is your immediate response, right? Another keyword that I notice those practice questions is best or most. Those are keywords that when you see those in a sentence and then you go read your answer choices, you want to make sure you are picking the best option, right? Another thing that I also think is extremely important when it comes to test taking and sitting down to take boards. I believe that if you know your ABCs, which is airway, breathing, circulation, it would also help you know which patient in that scenario that you're going to take care of first. One thing that I have learned over the years, those 4 answers, that's if it's just multiple choice, not select all that apply. But those answer choices are all correct. But which one is the best answer? Okay. Another thing is acute versus chronic. So if you have an acute situation versus a chronic illness, we want to treat acute first. So just keep that in mind as well while you're sitting down taking your exam. Also, I honestly believe that while you're celebrating, you've done your parties, maybe you start back working so you can get a little bit of money. Do not forget to do practice questions. You should be doing at least 200 to 300 practice questions every single day. There is so many resources out here that you can do practice questions. If you still have your ATI from school and you still have that login, you can do all of those practice questions. You want to read your rationales. You want to go back and review certain things. One thing I do know for sure that all your lab values will be on your exam. Like they will give you those. So you don't have to remember the numbers so much, but you have to remember if the potassium is low, what side effects will that patient have? Or if the potassium is high, what symptoms would you see in your patient? Those are the key things. But take a breather, take a little break, get back in there, do your practice questions, and pass that exam.